Hi, I'm Dr. Laubal from Back to Health, and in this video, we're going to go through an exercise routine to strengthen up your feet, make them nice and strong, and get them out of pain for the long run. Let's get going. Let's start off this routine with just a couple of stretches. We're going to loosen up our calf a little bit here. To do that, we're going to find a wall to brace ourselves against. In this video, we're going to pretend like my right foot is the one that's giving me pain, so that's the one we're going to work on. All we're going to do is we're going to take that right foot, the affected foot, we're going to place that back, and we're going to place our left foot forward. We're going to keep our back leg here, my right leg, keep it nice and straight, and put a little bit of a bend in my left leg here. Now you'll notice in this position here, my left leg doesn't really have a lot of pressure on it. I could kind of lift it up off the ground if I wanted to. All I'm going to do, keeping my right leg nice and straight, locking that knee out, I'm just going to bend forward until I feel a nice stretch in the back of my calf. Now, one of the things to pay attention to with this is not only is my back right leg straight, you'll notice my right heel is not coming off the ground. You should feel a nice stretch kind of behind the knee, a little bit down below that into the right calf. The important part with this stretch is that we don't want to overdo it. Just nice and easy, kind of warm the muscle up a little bit. We'll hold this for anywhere around 30 seconds or so, till we feel like we've got a nice stretch in that calf. This is what we call the gastrocnemius stretch. After we feel like we've got a nice little stretch going on in the gastroc muscle, we're going to switch over to stretching out the soleus muscle. Now, to do the soleus stretch, it's the same position as the gastrocnemius stretch. All we're going to do is we're going to take our affected leg, my right leg, the back leg. All we're going to do is we're going to take that right knee, and instead of having that leg be straight, we're going to bend that right knee down towards the ground. You'll notice I keep my right heel on the ground as I bend the knee, and I start to feel some stretch a little bit lower in my calf. You'll probably feel this a little bit lower down in the Achilles tendon, down where the calf muscle starts to attach to the foot. Same thing applies, about a 30-second stretch. No need to overdo it. The real benefit from these routines is derived not in any one session, but doing them consistently, day in and day out, over a period of time. Again, noticing my left foot here, I'm not carrying much weight on it. It's just there to kind of stabilize myself. As I feel that soleus muscle kind of loosening up, I can bend the knee just a little bit more, really focusing on keeping my right heel on the ground. Good. The next stretch we're going to do is called a split leg hamstring stretch. So what we're going to do is we're going to take the affected leg, my right side, we're going to step that forward about, I don't know, maybe 2.5, 3 feet. Get a nice wide base here. If you're feeling a little bit unstable, find something to grab a hold of. Push yourself up against a wall or something that's not going to fall over. We're going to keep both of our legs nice and straight here. Again, you can see my back left leg is nice and straight. My front right leg is nice and straight. And all we're going to do is we're going to lead with our chest. Okay, kind of keep our shoulders back here a little bit. We're going to lead with our chest down towards the knee until we start to feel a nice stretch. Now this stretch, you're going to feel a little higher up in your calf, maybe behind your knee. You might even feel it on the back of your leg here. Right hand placement, we can put that on our knee, we can put it on our shin, or if you're feeling very flexible, you can take it all the way down to the ground. To get a little added benefit from this stretch, we're going to take our back left hip, and all we're going to do is that left hip, we're just going to shift it. We're going to drive that down towards our right foot. So we're going to drive our left hip down towards our right foot. That'll kind of amplify that stretch. If you weren't feeling it before, that'll definitely help. We're going to hold this position for about 30 seconds. Again, just like the last stretch, there's no need to go too far, too fast. Consistency over time is important. And the next exercise we're going to do are called the toe extensor stretches. Now your foot extensors, your toe extensors on most patients are very tight, so this can be a little difficult to do, especially in the beginning. It can be somewhat painful, but you should be feeling a nice stretch across the top of your foot, up the front of your ankle, and up the front of your shin. Very common in the beginning to feel a sense of cramping in your medial arch when you do this. If that's the case, just go ahead and step out of the stretch, alleviate the cramping, and then enter back into the stretch when you feel comfortable. We're going to go ahead and do these stretches for approximately 30 to 60 seconds until we feel like we've gotten a good stretch. The next exercise that we're going to enter into doing is called the short foot exercise. Now, short foot exercises are very effective, and they're a great exercise to do because you can do them almost anywhere, but they don't show very well on video because it's an isometric contraction where we're going to raise our arch in the air by contracting the front of our foot to our heel, just by contracting the muscles in the bottom of our foot. So where we see here, I'm doing a contraction and I'm holding for approximately 10 seconds. And then I'll rest. I'll enter into another isometric contraction. You can see my foot working there, where I'm contracting the bottom of my foot, all those muscles in the medial arch. If you get a little cramping in the foot, just go ahead and back out, alleviate the cramping, and enter back into the exercise. Here's a contraction. Again, we're going to contract for a period of 10 seconds. Now, through that entire 10 seconds, we're contracting stronger and stronger and stronger, all the way up till we get to that 10 count, and then we can rest for 5 seconds. We'll do this about 5 times. Again, you can do this through the day, sitting at your desk, standing in line at the checkout counter, whether you have shoes on or not. Go ahead and do some short foot exercises. Strengthen up that arch. The next exercise we're going to do is called toe yoga, and this is the one where I have to ask you to not laugh because it's very difficult. It's harder than it looks. The idea here is raising our 4 outer toes up in the air independently from the big toe, and then raising the big toe independently from the 4 smaller toes. As you can see, it's not the easiest thing in the world to do. It's not so much of a strengthening exercise as much as it is a coordination of movement exercise, trying to reinforce the connection of control between your mind and your body. If you struggle with this one, don't feel bad. Stick with it. You will make that connection and you will gain independent control over that big toe. We'll do this for approximately 1 minute. The next exercise we're going to do is called a towel grab exercise, so we'll use a hand towel here. This is best performed on a smooth surface, like a hardwood floor or a short carpet. We're going to lay that towel down on the ground, and we're going to use our toes by contracting our medial arch to scrunch that towel up and pull it back towards our heel. Now, once you've got that towel back as far as you think you're going to get it to go ahead and reach down and flatten it back out and repeat. We can do this 1, 2, 3 times. Approximately 1 minute to 2 minutes should be sufficient. You may even notice by this part in the routine that your foot is getting a little bit fatigued. As you continue doing these exercises over time, you will gain more stamina and more strength, and that'll equal out to having less foot pain. The final exercise we're going to do is called the marble movers. So with this here, we're going to use a little marble or a glass bead or a small rock. And basically, we're going to use our toes to pick that marble up, give it a good scrunch, and then move it and set it back down. Pick it up, Scrunch, move it, set it back down. As you're doing this exercise, use different toes when you're grabbing the marble. You know, your big toe versus your middle toes versus your outer 1 or 2 toes. Have a good time with this. Do it for another minute to 2 minutes, maybe even 3. Really practice when you pick that marble up at the top. Give those toes a really good scrunch. Really contract that medial arch. And that concludes our foot strengthening exercise routine. Hopefully you found the information valuable. Do perform this at least once through each day. And if you have any questions or concerns, bring them to us at your next appointment, and we'll be happy to answer them.